Hello, I'm Bob Maunder. I'm here because I hope that our experience as healthcare professionals who've worked through the early months of this pandemic can help you in your workplace. I've been a psychiatrist at Mount Sinai Hospital for over 25 years, so I was here when we were hit with SARS in 2003. My job at that time changed overnight. Instead of my usual work, I was trying to support hospitalized patients who were very sick, many of whom were my colleagues. At the same time, I was trying to help the doctors and nurses looking after those patients to keep their heads in the game. Meanwhile, we were all afraid that we would be next and that we would bring the virus home to our families. So when COVID-19 grew into a global pandemic early in 2020, I felt the emotional echo of those months working in the hospital during SARS. I had a dreadful sense of here we go again, mixed with the fear that what was coming might be bad, without having any way to really predict what was going to happen. Our SARS experience is more than just emotionally or personally relevant, though. It also marks the beginning of almost 2 decades in which my colleagues and I have studied the stress that major outbreaks of infectious disease cause for frontline workers, and what we can do to stay resilient in the face of that stress. I want to share some of what we have learned because it may be relevant to your work, even if where you work is different in many ways from where I work. The first thing to know is that this is an extraordinary situation, so it is going to make you feel differently than usual, at least at times. It is normal to have reactions to stress that don't feel normal. It is not a sign of weakness or of mental illness to be affected by a stressful situation like this. It is expected. These reactions vary a lot from one person to the next, and they may change over time. They include poor sleep, strong emotions that can catch you by surprise, feeling tense and jumpy, being irritable with others, feeling too alert or feeling numb, and avoiding things that are stressful. All of these are normal responses to extraordinary stress. You won't be the only one feeling them. I've had all of these reactions at different times, and so have many of my colleagues. It doesn't stop us from doing our work for the most part, and it gets better when the situation improves. Here's a second thing to know. One of our very important goals is to be smart about managing real risks. To do that, we need to find ways to avoid being overly influenced by the fear that is all but inevitable at times. Of course, there is real risk, but it is very easy to overestimate or underestimate danger. The psychologist Paul Slovic taught us 2 things that determine how risky something feels. The first is how familiar or unfamiliar it is. The second is if it is under our personal control. Everyone tends to underestimate dangers that are familiar and under their control, like driving a car. On the other hand, we exaggerate risks that are unfamiliar and mostly not under our control, like being infected with a previously unknown virus. So, we have found that it is useful to do things that increase our familiarity with the situation we are facing and that increase our personal control over it. Learning and practicing new routines that are part of working in a pandemic, such as how to put on and take off a mask properly, makes these routines familiar, which makes the situation feel much more manageable and less stressful. Exercising personal control over risk when you can helps too. For example, keeping hand sanitizer available to use when you wish. It helps to look for opportunities to do things that allow you to take a degree of control over a risky environment. To finish, let me say that we're getting through this, and so can you. Thanks for listening, and remember, we're all in this together.